Hello and welcome. Today we'll be discussing a serious and often overlooked disease of gallbladder cancer. This cancer develops in the gallbladder, a small organ located beneath the liver, whose primary function is to store bile, a fluid that aids in digestion. The exact causes of gallbladder cancer remain somewhat elusive, but several risk factors have been identified. Chronic inflammation of the gallbladder, often due to gallstones, is a major culprit. Other contributing factors include porcelain gallbladder, a rare condition where the gallbladder wall becomes calcified, coloidal cysts, congenital abnormalities of the bile ducts, obesity, and exposure to certain chemicals. A family history of gallbladder cancer in certain ethnic groups, such as Native Americans and Hispanics, also have a higher risk. Gallbladder cancer typically begins as a change in the gallbladder's inner lining. Over time, these abnormal cells can proliferate, forming a tumor. This tumor can then invade the gallbladder wall and potentially spread to nearby structures like the liver, bile ducts, and lymph nodes. As the cancer grows, it can obstruct bile flow, leading to jaundice and other digestive problems. The cancer can also metastasize, spreading to distant organs like the lungs and bones. Gallbladder cancer is relatively rare, accounting for a small percentage of all cancers. However, its incidence varies geographically. It's more common in certain regions, such as South America, Eastern Europe, and some parts of Asia. It also tends to affect women more frequently than men, and the risk increases with age, with most diagnoses occurring in individuals over the age of 65. Unfortunately, early-stage gallbladder cancer often presents with no noticeable symptoms. As the cancer progresses, symptoms may include abdominal pain, particularly in the upper right quadrant, jaundice, a yellowing of the skin and eyes, nausea and vomiting, bloating, loss of appetite, weight loss, and a lump in the abdomen. These symptoms are often nonspecific and can be mistaken for other, less serious conditions, making early diagnosis challenging. Diagnosing gallbladder cancer can be complex. A thorough medical history and physical examination are crucial. Imaging tests, such as ultrasound, CT scans, MRI, and cholangiography, are used to visualize the gallbladder and surrounding structures. Endoscopic retrograde cholangiopancreatography, or ERCP, can help examine the bile ducts and obtain tissue samples for biopsy. A biopsy, where a small piece of tissue is removed and examined under a microscope, is essential for confirming the diagnosis and determining the type and grade of the cancer. Gallbladder cancer is classified based on the cell type and the extent of spread. The most common type is adenocarcinoma. Staging, typically using the TM system, so tumor node metastasis, helps determine the size and location of the tumor, whether it has spread to nearby lymph nodes, and whether it has metastasized to distant organs. This staging is crucial for determining the best course of treatment. Treatment for gallbladder cancer depends on the stage of the disease and the overall health of the patient. Surgery is the primary treatment option for early-stage cancer and aims to remove the gallbladder and surrounding tissues. Chemotherapy and radiation therapy may be used to kill cancer cells, either before or after surgery. Targeted therapy and immunotherapy are also emerging as potential treatment options for advanced disease. Palliative care focuses on relieving symptoms and improving quality of life for patients with advanced cancer. While there's no guaranteed way to prevent gallbladder cancer, there are steps you can take to reduce your risk. Maintaining a healthy weight, eating a balanced diet, and avoiding exposure to certain chemicals are important. Managing underlying conditions like gallstones and porcelain gallbladder through regular checkups and appropriate treatment can also help. If you have a family history of gallbladder cancer, discuss screening options with your doctor. The prognosis for gallbladder cancer varies greatly depending on the stage at diagnosis. Early detection and surgical removal offer the best chance of survival. However, gallbladder cancer is often diagnosed at an advanced stage, leading to a less favorable prognosis. Recent research is focused on developing more effective treatments, including targeted therapies and immunotherapies, to improve outcomes for patients with advanced disease. Clinical trials are also exploring new diagnostic techniques to detect gallbladder cancer earlier and improve survival rates. Ongoing research offers hope for the future of gallbladder cancer treatment and management.